Assalamu alaikum guys, I am Dr. Faraz Ahmed and today in this video I will tell you in detail about OET listening part C. So first of all, let me tell you briefly about the structure of OET listening part C. Guys, keep in mind that OET listening part C is the most challenging part of the listening subtest. Many people get confused, get worry about the OET listening part C, but don't worry at all. This is most challenging part of the exam, but never think that it's impossible. Everything is possible if you do it in a proper way. So guys, first of all, let me tell you about the structure of this exam, then I will tell you about the strategies how to deal with part C. Okay guys, so guys, in OET listening part C you will have 12 questions to answer, and these questions will be given in two parts. First you will be given first 6 questions from 31 to 36, then next 6 questions from 37 to 42. So you will be given 2 extracts and 6 questions from each extract, and these questions again will be MCQs type of question and with 3 answer options. Okay guys, so guys, question in OET listening part C can be direct type of question and they can be sentence completion type of questions. Okay guys, so here in OET listening part C, healthcare professional will be talking about aspect of their work. So guys, difference in OET listening part B and part C is that in OET listening part B mostly 2 or 3 people are talking, but in OET listening part C most of the time you will hear a single voice, and in that audio you can hear some lecture, you can hear some interview, you can hear some presentation as well. So from that single voice audio you can easily judge, you can easily answer your questions. Okay guys, let me tell you about strategies, about plan that how to deal with OET listening part C. Guys, keep in mind that before start of audio in OET listening part C, officially you will be given 90 seconds to read the extract, to read the question and answer options of these 6 questions in extract 1 or extract 2 of OET listening part C. But I think this 90-second time is not enough to read 6 question and answer option. So to deal with this problem, let me tell you a trick. Guys, as soon as you are given with OET listening part C, or when you are ended with OET listening part B, start reading the extract 1 of listening part C as part B is ended. In this way you can have easily 30, 40, 60 second extra time, so you can easily adjust these 60 second in officially given 90 second to read the 6 questions and answer options. Okay guys, during this reading underline the key or matching words. So in official 90 second and 60 second that you will get from this trick, so in this time you can easily read the question answer option, and you can also underline the important word from answer options as well. Okay guys, then after official 90 second audio will start, then what you will do, you will have to listen for the underlying keyword or synonymous word to answer that question. Okay, you will listen for that important word or synonymous word which you have underlined in question or answer option. So in this way you can easily get your answer of the question. So this is very important strategy. As soon as part B is ended, start reading the extract 1 and use your extra time, then listen for the keyword or synonymous word in the audio, so you will get your answer. Okay guys, so guys, first of all you will be given time to read the question and answer option, then audio will start, and then you will have to mark the correct options. Okay, so this strategy, that is reading, listening and marking the correct option, work here. So at a time you will be given time in start 90 second, but when audio will start, you will also read, you will be also listening, and then you will marking the answer option, correct answer option. So you will be doing all the three works, that is reading, listening and marking, reading, listening and marking at a time in OET listening part C. Okay guys, this type of test will be given to you in OET listening part C. Guys, let me tell you that how to apply the strategy of extra 1 minute 40 second in OET listening part C. Guys, as your OET listening part B ended, start reading this part C from here. You hear a presentation by the specialist cancer nurse, so you can easily utilize that extra 60 second in official 90 second. Audio will start from here, that in this part of test you will hear two different extract. Audio will start from here and audio will end up here. So audio will easily take 40 seconds, 50 seconds, and sometimes it can take 60 seconds. So you can use these 60 seconds in reading your question 31, 32, 33, 34, 35, 36. So guys, in this way you can apply your this 60 second extra 60 second strategy in OET listening part C extract 1, and you will get familiar with the question and the important words in answer options. Then you will start with audio. Okay guys, now I have told you about OET listening part C structure and strategies. Now let me play an audio of OET listening part C extract 1 for you people, so you can apply the strategies in this OET listening part C and try to answer the question 31 to 36. So listen to the audio.
Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1, questions 31 to 36. You hear a presentation by a specialist cancer nurse called Sandra Morton, who's talking about her work with prostate cancer patients, including a man called Harry. You now have 90 seconds to read questions 31 to 36.
My name's Sandra Morton and I'm a specialist cancer nurse, helping cancer patients deal with their diagnosis and treatment. I'd like to tell you about the type of work I do, and particularly about one of my patients, recently diagnosed with prostate cancer. Let's call him Harry, to illustrate the sort of things I get involved with. Now, before we get on to Harry, I'll give you a bit of background. Clearly, my job covers many aspects of patient care, but what's the priority? Firstly, prostate cancer is in fact the most common cancer in men in the UK, with over 40,000 new cases diagnosed every year. That's a staggering number. One problem is that this type of cancer actually develops very slowly, so there may be absolutely no sign that you have it for years. So, if we're going to reduce the number of cases, it's vital that people like me get the word out to as many men as possible, that we tell them how to spot the signs of prostate cancer, like an increased need to urinate or straining while urinating. Unfortunately, the cancer can be at an advanced stage by the time patients come in for tests, at which point the available treatments are far less effective. So, let me tell you a bit more about my patient Harry. Like many middle-aged men, Harry was offered a routine health check at his local doctor's surgery. As far as he was concerned, he had no particular health problems or obvious symptoms at the time, and so he almost ignored the invitation. But he'd promised his family he'd look after himself. His wife had died of ovarian cancer some years before, so he felt obliged to go. It was during his appointment that, based on a few symptoms he mentioned, Harry's doctor decided that he'd need further investigation for prostate cancer, and referred him to a specialist clinic at the hospital. Harry's trip to the clinic started with a routine blood test, which initially showed a slightly low haemoglobin level. A further test then revealed that his PSA, the prostate-specific antigen, was high at 20. He then saw a urology consultant who conducted a digital rectal examination and biopsy. A procedure that I always try to explain to patients may be uncomfortable, but is entirely necessary. In fact, though, Harry said the 3-week interval between having a biopsy taken and hearing the outcome was far more of an ordeal. Harry told me that when he went to see the consultant to get his results, he immediately sensed he was in trouble. Although the consultant was very considerate in delivering the news, unfortunately the indications were that Harry did indeed have prostate cancer. He was assured that the cancer was low-grade and not aggressive. Harry had suspected the worst, and though he'd tried to prepare himself for it by doing some online research, finally hearing that confirmation was still a shock. In fact, the very mention of the word sent Harry into panic, which was very unlike him. So at the time I first met him, he was very vulnerable and grateful to have someone to talk to. Of course, the response to the illness amongst prostate cancer patients like Harry can vary enormously. I've dealt with some men, for example, who haven't really realised the importance of keeping up their medication because they've felt relatively well, especially if they've been experiencing unwanted side effects. Unfortunately, though, any break gives the disease the perfect opportunity to spread into the bones, making it much more difficult to treat and a successful outcome less likely. And some treatments do cause some unfortunate effects, such as erectile dysfunction, which some men really feel uncomfortable discussing, because it's a sensitive issue. Other patients have mentioned that even though they've been given a lot of help, it's still difficult to weigh up the pros and cons of the various treatment options they're offered, from ultrasound or radiotherapy right through to radical prostatectomy. So responses like these need to be taken into account by specialist nurses when talking to patients. For me, these factors really underline the importance of the community follow-up clinics we have in my area, which address many of these issues in the provision of healthcare for cancer patients. Staff at these clinics see patients during their recovery and only send them back to hospital for treatment if they develop significant new symptoms. Seeing patients in the clinics means that staff get to know each patient and build a relationship with them, which enables nurses like me to dispense advice and answer questions. And although we have no firm evidence, staff feel that's far more beneficial to patients than attending a large hospital clinic. So we're hoping more clinics like these can become available.
Okay guys, thank you very much for watching the video. Please subscribe to the channel and like the video as well. Please share these videos and recommend it to your friends and the other people who are preparing for OET. So guys, thank you very much. Allah Hafiz.